You just use the standard wipes that are used to wipe the mattress covers in hospitals. And the first place to start is inside the cover here, if any body fluids have been in. When it's taken off and put back in storage or taken out ready for a new patient, this must be checked first to make sure there's no dirt in here. It's a good idea, even if there isn't, just in case there's any dust, just give it a quick wipe. Don't be afraid of changing the wipes as often as you like. Once you've done a section like that, then work on the outer area. This will have a piece of hard plastic in it, so it'll make cleaning easier on the later models. Then on the zip, just make sure you get the wipe inside that groove and push it along here. If there's any body fluid, because of the positioning of these devices, the body fluid is usually blood. So you will notice it'll be stained. We don't get any other body fluids on here, like urine, because of the position of the device. And you turn it, the outside one, just keep changing your... This is where we get most of the dirt, on the outside, as the patient leans over and uses their hands, and we found some blood on it once or twice. That's that. Right, just make sure you do this. You can just hold this tight here and push down so it'll get the stitching. The stitching is quite robust on these, so don't be afraid to really drag it. That's that cleaned. Just wipe down. You can do it any way you like, but I prefer to wipe down and make sure you're getting everything. There's a little spot here. This little bit of effort will get rid of that. Then turn it off and do this side. Then the back, changing the wipe as necessary. A little bit of a fingerprint dirt here. Just remember to do the edge. And the last piece is a piece that's been on the ground. Do it like that. You can see in the light usually your marks if you've missed anywhere. Just make sure you're getting it all, and the edge again. And they should be left to dry. This dries very, very quickly, but it's been done that way so this area won't gather any dirt while you're cleaning the other areas. Under here, you just slip the wipe under and pull against it, holding it down here with your hand. Just wipe under it like that. And it's just a question of then wiping all the areas, keeping the battery compartment closed. These are just flat surfaces. I'm doing the easiest areas so far. It doesn't matter if you rob hard on the reset button on these areas, but when you come here, some of the wipes do carry quite a bit of moisture, so make sure you don't get it in these connections, the battery connection, the DC or the nurse call. Don't try putting it in and cleaning it, just wipe over it like this. And that's that done. And you just need to start from the top, holding the lead, rubbing down the lead, and it has a little plug at the end. Just wipe the plug. If you get damp on it, it doesn't matter at all, and it will dry soon. And that's the clean.